Well, let's start on health. Now, the Ghana Health Service is urging the public to be cautious of their health and revive all known preventive measures to avoid any possible outbreak of Ebola in the country. The warning follows a health alert issued from DR Congo to Ghana on new cases that country is recording. Neighboring Nigeria has already stepped up screening processes at its various national airports to ensure no outbreak is recorded there. It will be recalled that about 2 years ago, in the wake of outbreaks recorded in parts of the West African region, Ghana introduced some national emergency preventive measures to deal with the health threat. What are the statuses of those emergency measures and what needs to be done now? Director of Public Health of the Ghana Health Service, Dr. Bedusa Kodie, says the service is retooling the various health facilities and laboratories as part of immediate measures to contain any such occurrences. He spoke to my colleague Daniel Dazi earlier on News Today.
The legacy of Ebola 2014-15, we put in some mechanisms to prepare our facilities to create public awareness, to make sure the staff are safe and the entire the national community is safe. Some of these things we need to reactivate to make sure that as we expect them, they function, and then the time that you need them, they'll be available for you. And that was the relevance for the alert which we sent to the regions and the various health facilities, teaching hospitals, and so that the various preparedness at the facilities getting holding places readily available so that should there be any suspected case, it can be handled without affecting other cases. And then making sure that the staff would also be sensitized to use case definitions to be looking for possible cases, and then also getting the various laboratories ready for confirmation should there be any suspected case, what to do. These are the things that we need to put in place, and what we have enhanced them to make sure that the country is prepared for any eventuality.
Dr. Bedusa Kodie there. I'm joined in the studio by the president of the Coalition of Health NGOs, Dr. Gabriel Benaku, so we can have a very quick conversation about this development. But Dr. Benaku, thank you very much for coming.
Thank you.
Has your outfit heard about this alert, and what more should we know about it?
Yeah, thank you. Yes, we are already aware 3 days ago. We are
3 days ago?
Yes, we are already aware. We have a network within the Africa region, and the Coalition of NGO in Health is a mentor umbrella organization to many civil society within Africa. And so we have the network. We are already aware, and we know the Ghana Health Service, with all the input we made during the Ebola outbreak.
Now, what exactly does the alert that we're getting from the DR Congo say? That they are recording new cases there, right?
Yes. So they already have some cases recorded, but there are already some suspected cases going through laboratory screening.
Okay.
And therefore, because of the incubation period, it could take time. But the reality is that people have moved from DR Congo to other parts of Africa. And even globally. Because of technology now, within 4 hours, you can be in other countries. So Ghana is just part of the family. That should be much more prepared than ever to be able to start at the ports, at the entering points. And the Coalition of NGO already have done some work on Ebola before. About 37 districts in Ghana are connected to other parts of West Africa countries, which is very crucial. So you may not be focusing on only the airports, but you should be focused on the sea and the other parts of the country where it's easy for other neighboring countries' membership to pass through. So what it means is that currently Ghana have passed the test of the Lassa fever by immediately identifying, and our system was able to match up. That is a plus for Ghana Health Service. But Ebola, we want to see much more robust system put in place, not only in Tema.
When you talk about robust system, exactly, and I think you were going to come to that.
Our laboratory systems in Ghana need much improvement.
Okay.
We need much more sophisticated laboratory equipment in all the regions, not just in Tema, in Kumasi and Tamale.
Right.
But we need it in all the districts and the regions.
Okay.
Every hospital facility have certain requirements of facilities that need to be put in place. Right. So regional hospital must have the necessary equipment that it requires.
Okay.
The district one must also have. So what we are asking now is, this is the test case for Ghana Health Service again to pass by ensuring that they can make very strong case for the Ministry of Health to be able to put it into their budget for strengthening our national surveillance and laboratory systems.
Is that enough?
Yes, when we have very strong laboratory systems, it is easier, less than 24 hours. We could have much more information to take quick decisions. Okay.
Based on what we've experienced in the past, what are the key lessons that we can learn that which we can apply in these times?
I must say that thanks to Ghana Health Service, Ministry of Health, recently we had a health summit. The role of civil society has been well recognized, and the media for playing critical role in health outcomes. Yeah. And so that is why we have seen that there has been much collaboration now. And all that we are asking is that we would like to be involved at the national, regional, and district committees where civil society, if you check the Ebola outbreak or other emergencies, civil society have played critical role. WHO have recommended, World Health have recommended, World Bank have recommended, and other agencies have recommended civil society critical role.
Right. So if I get you right, you're saying that going forward, if there are any steps to be taken, especially by the health service, they should include more
civil society can play critical role. In addition,
media,
the National House of Chiefs, and
the
religious groups have played critical role in terms of development, in terms of surveillance, because they can command a larger group. So all that we are saying is that all the outline that Dr. Badusa have outlined, they are very beautiful. We want to see an engagement now to begin to test how Ghana Health Service is connected with other players within the health sector. They can't do it alone. They must obviously improve collaboration with other sectors, the traditional council, the religious body, civil society, the media, not just calling for news, but engaging media to educate the media about even what to report. It's not just about you calling them, but it's about they calling you to give you much more technical information about some of the terms we use. We need to demystify health as a technical issue. We need to make it much more public concern so that people can play critical role in identifying, in giving early warnings, and in referring and in contributing to health outcome in the country.
Okay, well, finally, let me ask you to take us through, I mean, as the Ghana Service is talking about reviving the preventive protocols, let's maybe start with helping our viewers with a few things that you need to do to keep yourself safe. If you can go through it step by step for us, what are some of the things that you should do to keep yourself protected as we're on alert?
There are 3 cardinal things every Ghanaian should know. First of all, when you are feeling dizzy, tiredness, consistently with headache, see your healthcare provider. When you take painkillers consistently and you are not getting away and you look tired, see your physician or see a healthcare provider. When you visit public gathering, try to avoid greeting people with your handshake.
So we're back
Even
to
when
the
you do that,
avoidance.
You have to use the sanitizers to do it. So these are the 3 critical points. And lastly, weekends, don't get into too much crowd. Get yourself out of crowd, because it can easily get you.
I'm going to have you go over it again for me. So first of all, avoid avoid crowds,
avoid
right?
crowd.
Avoid
it's very
being
important. In a big crowd, you get yourself into crowd and you are sweating, and you want to be there because you want to see what is happening, but it is hazardous to your health.
Okay, well, that doesn't mean you should not come for the Joy FM corporate jam.
That's not what I mean.
The corporate jam is on for Friday. You come with the sanitizer.
If you have auspicious and the environment is it's okay.
Good. Okay,
but
so we are good.
When you have an enclosed zone, there's no even air condition, there's no air blowing, and you are sweating unnecessarily. That is it. When you have headache consistently and you decide to take painkiller, you don't need to do that, but you need to just get your healthcare provider. These days, it's easy for you to talk to a healthcare provider so that they can be able to help you. And always wash your hand with soap.
So that's one. I wanted you to go through it again just so we grasp it. First of all, don't be
headache.
Avoid the crowds.
Yes.
Okay, let's start this way. First of all, avoid the crowds as much as possible.
Yes.
That's one.
Yes.
Secondly, you said if you're experiencing severe headache, don't just self-medicate.
Yes, you
try and seek professional medical care. Okay.
And always use disinfectant or
always use disinfectant. So back to the sanitizers that we used to. We got hooked on some time ago. So sanitizers.
It's actually supposed to be a lifestyle. Everybody must use sanitizer. Or
every now and then.
Exactly. It's a lifestyle. It's part of the human system, so that you can minimize a lot of infectious diseases that we take.
And then you should avoid handshakes.
Yes, handshake in the public. You know, Ghanaians, our culture, you get to funeral, you greet, and after that, you never know what the person is carrying. Then you just inhale, or you hold your nose, and it can create unnecessary if the person is carrying. Because the window period can hide a lot of people, and you may think that this region is not affected, this country is not affected. But I tell you, within the 3 days, people have moved in and out, and they could be carrying, they could be carriers, and therefore they can move to any part of the country, they can visit families, and they can get it. So all that we are saying is that before the alert that Ghana Health Service is issuing to all the districts, let's educate ourselves by avoiding the 3 principles.
Okay, yes. And also you're asking the health service to make sure that every district has the sort of robust systems, counter Ebola systems that we've seen in Tema, etc. Dr. Benaku, thank you so much for coming to the studio. Dr. Gabriel Benaku there, he's the president of the Coalition of Health NGOs, helping us with information. So you stay protected, make it a lifestyle, he says. Basically, you remember that we were told to wash our hands frequently. So wash your hands frequently, avoid the crowds if possible, use a lot of hand sanitizers, keep yourself safe from all of this. In the meantime, we're still waiting. It's not here. We're getting an alert from Congo, so it's not yet here, but we'll be safe. We're sure that we'll be safe.